Dr. Matthew Badtke. Good morning, Matt.
Good morning.
Welcome back.
Thank you.
We've got new diseases. Last time we talked about the monkeypox, but that's not it. But wait, more.
There's a lot of strange things going on with infectious diseases these days, and I think we've seen this outbreak of monkeypox, which is really weird. It's happened before. It's not the first time that we've seen that, but it's a virus that usually is spread from animals. It's been associated with exotic pets in the past, prairie dogs in particular, which is kind of odd. But now we're seeing this pop up in a bunch of countries, including the US. I think 30 different countries it's been seen in. There's been about 500 cases of it, which is unusual to see that large of an outbreak. We're seeing cases of hepatitis in kids, which they're not exactly sure what the cause is, but it's looking like it is an adenovirus, which again is a virus that is very common and has never been associated with these sort of symptoms. So kids are getting pretty severe hepatitis, potentially needing hospitalization, some even needing liver transplants, which again is weird and not normal. So people that research this stuff are thinking that some of this has to do with the fact that a lot of our patterns of immunity, a lot of our patterns of behavior have been really disrupted over the last couple of years, as everybody knows. And so the normal levels of immunity to different viruses that are circulating normally are different, right? We all wore masks for several years. We all had months where nobody went out and nobody interacted. And so that has changed some of these patterns, and it looks like that is what might be leading to some of these really odd outbreaks and things that we're seeing. The question is, how long until we sort of return to that normal level of immunity, and how long until our behaviors return to those normal levels, and maybe some of this will start to fade away. But it's been kind of odd to see this over the last couple months.
It's interesting you bring that up about immunity and our immune systems, and I know someone who has really only been out and about, let's say, twice during the pandemic.
Right.
Both times after they returned home, horribly sick, like flu-like symptoms. No COVID, but
Right.
just every time they go out or in a big crowd, they come back and are sick and worried about the immune system. And is it because that we have kind of just sheltered and hid more or less for a few years?
I do think there's a decrease in immunity to some of these normal things. I mean, my son's preschool class, similar sort of thing. Like when they had spring break and then came back in the last couple months, a lot of the kids have had influenza. So not COVID, but again, the kids are pretty sick with influenza. My son had that as well, and was coughing and stuff. And so, that happens. We're seeing really weird things with influenza levels, right? Normally we think of influenza as peaking in the winter and then basically going down and pretty much going away during the summer months. That hasn't really happened this year. I mean, it was peaking in April and earlier this month, which is strange. Again, unusual, and probably because of some of these changes from the pandemic.
Have we used too much Purell and Clorox?
No, that's always something that people ask about. When we think about like resistance to certain things, antibiotic resistance, stuff like that, no, the alcohol that's used in the hand sanitizers, that's not really working through the same sort of mechanisms that you're going to see resistance to. So no, it's not a response to something like that.
We're seeing allergies, new allergies pop up. People who have never had allergies experience them before. Is that just a seasonal thing? Sometimes you get allergies, sometimes you don't.
It could be. I mean, some of these things, it's going to be hard, and it's going to take probably a little bit more time to know whether this is something that's really associated with the last couple of years or just the random variation that we see. But I do think some of these sort of odd outbreaks are pointing to some really different circumstances that a lot of folks have.
You mentioned hepatitis, and the FDA is warning that strawberries have been contaminated with hepatitis. How can that possibly be? I get the salmonella contaminating produce, but
Well, this is hepatitis A that they're talking about there, right? So several different viruses that cause different forms of hepatitis. Hepatitis A is usually the most mild, and it is transmitted from the digestive tract. And so if you have people that are handling strawberries, or a lot of times you see this with green onions or things like that, and are not following proper hygiene practices, then you have the potential for contaminating the food with the virus, and then when somebody eats that without washing it or whatever, you can pick it up. So,
wow. And that's how the Jif peanut butter or any other thing contaminated with salmonella is
some salmonella is typically from probably a contamination from maybe the processing or maybe the peanuts themselves. I don't know if that's usually the same sort of mechanisms, but yes, that, wash your produce.
Yeah.
Yeah, for sure. Wash your produce.
Even the bagged lettuce, if they say it's washed, I wash it again.
I wait until the little sprinkler comes on at the thing, and then I get it.
Okay.
Then I know it's washed.
There you go.
It's true. It's refreshing in the summer.
When I was a kid, I used to stick my hands in there.
Last week.
Yep.
The virus, the COVID, continues to evolve. There's a new variant with new symptoms and
Right.
BA.D12.1.
Yeah, I forgot the name of that.
Right.
I wrote it down. So now is this is not a more severe or anything? It's just
Doesn't
a
look
more
like it.
contagious.
Yeah, I mean, we're going to see these, and they're really considered subvariants at this point. So we sort of had the Omicron, and then we're seeing other subvariants come off of that. This is a normal process that happens with all viruses. Most of the time, people just don't really care, don't pay attention to it. But this is what's going to happen. It's going to keep happening. We're going to have this constant change of the virus sort of adapting itself. As you still have a lot of cases, especially globally, we're seeing lots of cases. So we're going to keep getting those changes occurring. And again, we're not seeing anything that indicates that there's not still going to be some protection from vaccination. I think there's confusion a little bit about what the vaccine is doing for you. It looks like protection from getting infected might only last for a couple months, but what the real reason why you should get vaccinated is because it's going to prevent that severe illness. All the vaccines are very effective. Even for these new variants, they are very effective at preventing severe disease. And so that's why right now, even over the last couple of weeks, we've seen cases going up. We've seen hospitalizations starting to go up a little bit, but deaths have remained flat, if not gone down. So that's encouraging.
So the next round of vaccines, so everyone that has the protection from vaccines that went through the first 2 or 3, then the assumption is that every year or at some point there's going to have to be a process where we'd go through the vaccine all over again. Is that in our future as a annual thing?
I think it's possible. I think there is talk from I think Pfizer and Moderna have both said that they're working on updated versions of the vaccine, probably for fall. And I think that is, at least for this fall, going to be something that we probably see. The question is just, at what point do we see that the virus becomes mild enough that it's, not a requirement for the vaccination. But I mean, the process of changing it every year is something that we're very familiar with from the influenza vaccine. There's a very set standard process that people basically go out about 6 months in advance of when influenza usually starts peaking, and they go and they look and they see what are the strains that are circulating, and then that's what's used in the vaccine. It's not perfect because then there's the opportunity for the virus to maybe change some in between the time when you start making it, but you can at least dial in hopefully some of those new strains each year. So maybe a process like that is what we're going to need to do.
Will it eventually, do you think, be a part of the one flu shot, or will it be separate for a little bit?
There is talk about that too, a combination COVID-19 influenza vaccine. So you basically get one shot, and that's, again, something that's very common. We have many vaccines where there are 2, 3, 4 different infectious organisms that are all included in there together.
Like the super vaccine.
Yeah, I mean, and we have those.
And it would, I think, if you marketed it like a super vaccine, people would want it.
And if you gave like a piece of chocolate with it, people would want it too.
Exactly. Or if you called it extra strength. Now,
Or super size.
if you have a headache, are you going to use Tylenol or extra strength Tylenol?
Good point.
Well,
Extra
why would
strength.
why not? It's like,
Because you have a mild headache.
it's a very mild headache. I'm going to use the
Light Tylenol.
yes, the weak Tylenol.
Interesting.
Done with classes for now?
Yes, I'm off, and we start again Monday for our summer term.
People can still register right now.
Absolutely.
What classes are you offering this summer?
I'm teaching public health and chemistry.
Awesome.
2 things for the summer.
One of your favorites.
Chemistry. Yeah, it's my favorite.
Okay.
Great. Thanks for coming in.
Great to be here.
Chair of the Science Department at Jackson College, Dr. Matthew Badtke. Stay tuned. We've got more of the morning show coming up.